I know that the patients and their families are at the worst point in their lives. Just to be there with them in that moment and help them get through it, that's the most rewarding part. The moment I knew I wanted to be a nurse was when my mom donated her kidney to my dad for his third kidney transplant, and I was the primary medical caretaker for both parents at the same time. It was pretty wild, both parents being in major surgery at the same time, and I would run back and forth between the wings of the hospital to give care and be around the doctor's rounds. Everyone kept mistaking me for a nurse, and I'd be like, no, but the thought got into my head, and I was like, maybe this is what I should be doing. My mom met my dad when she was his dialysis nurse, and so they dialyzed at home, and I grew up next to the dialysis machine. I would change the dialysate fluid. That was my job. He wasn't expected to live until we were out of elementary school, and now he's seen all his daughters get married. He is the most supportive dad. Making the career change took a while. I was in the corporate space, and then when I got laid off from corporate, I said, hey, maybe it's time that that dream happens. I felt like all the puzzle pieces were finally falling into place for me. I felt like it was the right time, and so at 38, I started nursing school. I officially became a nurse in February of 2025. My family was there at graduation, and they were so proud of me. My dad immediately said, you're gonna take as great care of those patients as you took care of me.
Hi, I'm Michelle, and I'm gonna be your nurse today.
I see my dad in all of those patients. I want to treat them like family because I've been there. To be giving care to other patients besides my dad in such a full circle, rewarding way that brings tears to my eyes, honestly. And it reminds me of why I'm doing this. I want to be just as good of a nurse as my mom was for a patient like my dad.